Bismillahirrahmanirrahim. CME update by Mother and Child Survival Group of Pakistan. Me, Dr. Tariq, Gynae Family Emergency Specialist, Internist, Gulf KSA, presently a district gynecologist. The topic for today is a very important one of CME, that is LARCS, long-acting reversible contraceptives, which includes number 1, copper intrauterine device, number 2, progesterone intrauterine LNG IUI system, number 3, depot injectable progesterone and progestogens, and fourth is a progesterone implant. And these are very cost effective and are very popular, and they do not have any notable side effects. They are very cost effective as compared to the ones those are daily users, concurrent daily users. The copper intrauterine device is good for diabetic, breastfeeding, and for those and for HIV positive women. They have an infection. They have a ratio of 1:100 for the pelvic infections, and for the 1:1000 for the perforation, and for the 1:20 for the expulsions. They have some erratic bleeding problem and pain, and that can be settled. Mostly women leave this copper IUCD within 5 years. They are effective for 3 to 5 years. And then comes the progestogen IUI, LNG and IUI system. It's also very effective one. It has got a lower, the IUD, copper IUD having 10:1000, and this has got 10:1000, while the copper IUD have got less than as compared to LNG IUI. This LNG IUI has the same rate, is the pelvic infection rate 1:100, and that is 1:1000, and perforation 1:100, and expulsion 1:20. And there is a slight increase in the level of acne, and there is some bleeding, irregular bleeding, and then there could be amenorrhea as well. So these are ideal for those for the diabetes, estrogen dependent conditions, and for migraine. So, and they have also got the less failure rate, and they also do not increase the weight like copper IUD, and also they do not affect delay in the fertility. And then comes the injectable progestogen, which are basically as injectable progestogens, and they are depot progesterone, and they are good for estrogen dependent conditions and migraine, and for other like epileptic person who are using anti-epileptic like carbamazepine. However, there is a problem with them, that they had got a slight mineral density problem, bone marrow density problem. Bone mineral density problem can lead to some osteoporosis, and there is also delay in return in the fertility. There is erratic bleeding, and there is amenorrhea as well. And the fourth one is the progestogen intrauterine intrasubdermal implants, and this they are good for, they do not increase the weight, do not decrease the libido, mood, and weight also. There is some chance of acne, and there is also cost effective. They are also cost effective and are useful for the contraception, and they prevent, basically these all LAR acting reversible contraception are used for preventing pregnancy and for contraceptions. In UK, this is very cost effective, 8 to 10% of the, because of the, they are used once a month or in a cycle, and 8 to 10% they are used in for 19 to 49 years of age. There is a less chance of some ectopic pregnancy in IUD and IUS system, and also they are very cost effective, I have told you already. And there is also these injectable progestogens are very effective, as, and they have got the 12 month and 3 monthly and 2 monthly, and northeastern and net is 8 weekly, and this depo-progesterone is 12 monthly. They have got a failure rate, this depo-progesterone has got a failure rate of 4 is to 1000. And then for a period they also causes amenorrhea. If that amenorrhea persists long for after leaving this injectable progestogen, then additional contraception are needed. So this a brief review of long-acting reversible contraceptions, merits and demerits, and in which the LNQIS system is very good with the copper IUD and the injectable depo-progesterone and subdermal implants. Thank you for a patience listening with the LARCS. Will come in another review, and we must not forget, and La ilaha illallah Muhammadur Rasulullah, this we must recite when we leave this world, and La ilaha illa subhanaka inni kuntu minaz zalimin, and also wakafa billahi wakila wakafa billahi nasira, and all these are very so thank you very much for your patience listening, and best wishes and luck. And we must not forget our past. We'll review when another one, CME, Wama Alena Illal Bala.